Hi everyone, my name is Heather. I'm an APRN at a breast cancer center, and these are the bras that we give all of our patients for lumpectomies, mastectomies, sentinel lymph node biopsies, axillary dissections. This is a great compressive bra. This is high compression from Prairie Wear. I'm going to show you how it works. So I do like the fact that, I put these on patients every day. This is a game changer. So especially if you have someone that you actually have to help put it on because maybe they can't lift up their arm, or they can lift up the one without the nodes and the other one, they can lift that one up just fine. It's great to be able to take this off and like manipulate it around them. Love that, great feature. I want to show you how to put this on. So these are antimicrobial, so they're great for after surgery. The recommendation is to actually put this on after surgery, but that's not every surgeon's choice, and not every patient can tolerate it. So I want to show you how to do it. So we basically hook this hook first, and you're gonna see me struggle with this. It's a brand new bra. So I'm gonna hook this. So it's very compressive. So obviously sometimes it takes two people, but it is very stretchy. So looks can be deceiving with this bra. You want it tight. So some people look at it and they're like, I'll never fit into that. You probably will. The sizes, you can go on the Prairie Wear website and you can put in your numbers. It'll ask you so you can get your exact size, or you could just measure yourself. Or, I know I'm a 32, 34, so the sizes are on there as well. But I would just, go to the website if you want to and plug it in. So I've hooked the middle, I hooked the bottom. And then now I'm going to zip it up. I would say the first time is always the hardest. And then after that, it just gets easier. You don't have to wash it because it has that antimicrobial layer that will come off after you wash it. So this is great post-op. You want to wear it as much as possible after a lumpectomy. If you're doing a mastectomy without recon, your doctor will tell you when you're allowed to wear it. And then also when you're having a sentinel lymph node biopsy and axillary dissection, this is a great bra for lymphedema prevention because it goes high up on the axilla. It also has a little pocket inside where you can put like a little pillow, a little lymphedema pillow. You can tuck that right inside there, which I highly recommend because it gives you that extra pressure, which you need for healing, preventing seromas, the hematomas in the breast. You can also put it on the incision in here, which I like to tell patients about if you're having additional swelling or that hardness, is really helpful for having that go away, or if you're feeling something coming on. But I say, this is what we tell people and what I've just seen, if you're able to wear this for the first 30 days post-op as much as humanly possible during waking hours, you do not have to wear it to bed because again, it is compressive. That is the best thing that you can do to help with healing and then prevention of lymphedema, prevention of seromas, hematomas, and infection. Of course, you can wash it, and you can wear your post-op bra for sleep, which is a lot less compressive, and then you can put this on. If you're a plastic surgeon did reconstruction, that's a whole different ballgame. You'll have to find out when you can actually wear this because that's going to change the timeline with that because you don't want to undo everything that you just did. But for a simple like lumpectomy or a mastectomy with the nodes, like you definitely can get this on, pretty much right away. If you're doing radiation, this is going to be your best friend. So you want to wear this up until your radiation. You wear it during radiation as much as you can tolerate. And then after radiation, it's best to just keep wearing this, like, again, the same thing daily for like at least 30 days and then as needed after that. And that is going to really help with like post-radiation swelling, which is very common, post-radiation edema. So it's just not always comfortable when you're getting radiation to wear a compressive bra. So that's okay. You don't need to wear it during that time it's uncomfortable, but when you're able to tolerate it, wear it again for that 30 days as much as possible, not to sleep. And then you'll see a huge change. Go to your breast rehab. In addition to that, I would just like to bring up that this bra is going to be the friend for your rest of your life. You're going to wear it on planes. You're going to wear it if you're going to be doing heavy lifting, if you're doing a lot of activity, running. This is like the perfect bra for a prevention. So essentially, I just want to mention that it's not just something that you're going to wear post-op and that's it. You're going to wear it during flares. You're going to wear it when you're feeling uncomfortable. You're gonna wear it when you're feeling any kind of swelling. It's just there. It's going to be there as needed throughout your life. So I just want to keep that in mind that this is a great investment. I'll show you the back of it. It's cute. I do know that my older patients do have difficulties with dexterity. So sometimes they'll just keep it zipped up and then they'll unhook this and get their body in it that way. Because otherwise it's very difficult for my little 70-year-olds to put it on. That's not every 70-year-old, but some of them have a difficult time. But one woman, she was in her 80s, she was so cute. She showed me what she did. She's like, Heather, I just keep it all the way up here. I take this off, I rip it off, I could put it back on and stuff everything in. So that's how she did hers. And I thought that was a really great idea. And then I have patients who are just bigger busted, and it makes it so they feel like they can't breathe, or they have a uniboob. There are extenders that you can buy also. And there's also there's another, I think it's called like the hugger, where it's still a high compression, but this is like higher up, and it's just it's just shaped a little bit different, but it still is high up underneath the axilla. So there are options with it, but ideally this one is a good one. But yeah, I just wanted to let everyone know that it does kind of cut you here if you're a heavier set. They do have the extenders, and you can also get a different cut. And so this way it'll make it so it's just a little bit higher. And I feel like some people like that better, can tolerate that better, but you want to have that high compression. But that's the Prairie Wear bra. I hope the PRIMA Prairie Wear bra.